When does a woman's sexual desire really decrease in life?
Sure, sure. It's a complicated question. It's not easily explained or understood either. Um, it's very unpredictable, and there are various biopsychosocial reasons why a woman's desire reduces.
When you say biopsychosocial, what do you mean?
Yes, I'll come to that soon.
All right.
So it's all to do with testosterone. We've seen the two hunks just now, who had MMA. They have highly performance orientated, highly motivated. It's the same in a woman. You think of testosterone as the male hormone, male sex hormone, but it's also present in women. It's about 1/10 the level in a man.
Okay.
So it's 1/10 of testosterone is in a female, but at any one time, there is more testosterone than estrogen in the woman. And testosterone is needed for all these things like bone health, muscle strength, bone density, and generalized well-being and mood, and of course, sexual desire, interests, thoughts and fantasy, plus motivation, right? So testosterone levels gradually decline over the years, all right? So you'd expect testosterone levels in a woman to be half of that, of what it was in her 20s at the age of 40. So when she's 40, you'd expect testosterone levels to be half of that, of what it was at the age of 20. And it needs to do all these different things, and it is produced mainly by the ovaries and the adrenal glands in the woman, as opposed to the testes in the male, obviously.
Okay.
All right.
Right.
Now, the depletion of these levels,
Yes.
the hormone levels, are there any factors that causes it to deplete faster, or is there anything that the women out there can do to actually slow down the depletion?
Sure. The decline is unpredictable. There's no exact cutoff or limit at which it occurs. But sorry to interject just now. The various reasons can be divided into biological, psychological, and social reasons. The psychological and social reasons account for the vast majority of reasons why women's sexual desire reduces. Okay. Psychological reasons such as anxiety, depression, mood disorders are very common in women, and especially if she has a low self-esteem or a poor body image. These are common things that occur in women, and this can affect a desire. Other things would include physiological things like having a pregnancy and delivery. That's when your testosterone level drop. In fact, after a marriage, the testosterone level tends to drop also sometimes. And it tends to increase in men after divorce, interestingly.
And
Right?
why?
Yeah, if you don't know. So these are all the things. These are all the biological factors. And the psychological factors, the social factors would include things like having a marital affair, for example, or in a very bad, toxic relationship. If the relationship isn't going very well, no matter how much testosterone you give to replace it, it's not going to make it better.
Oh, wow.
Yes. So you have to correct the social problem, which is the relationship problem, and things like that. And of course, there are some medical conditions that can cause desire to drop. If you could think of menopause as a medical condition, it declines gradually over time, over age, menopause. I've spoken to you about pregnancy and breastfeeding. Other medical conditions would be chronic illnesses such as hypertension and diabetes. That's very common. As you get older, you're going to get all these things. Then, of course, as we've alluded in the past, psychological illnesses are getting more and more common. SSRIs, which are antidepressants, are very commonly prescribed. They're another cause of reduced desire.
Wow,
so the list can go on and on and on.
It's a very, very broad list.
Yes, but the vast majority are psychological and social reasons.
Now, doctor, we've covered about the hygiene and also vaginal dryness and sexual desire. But one more issue that's still very prevalent in our community is sexually transmitted diseases. Now, what can women out there do to prevent sexually transmitted diseases?
Right. The only way to prevent it totally is abstinence, right? But if you're having sex, then condoms are protective. They're highly protective against sexually transmitted infections. They protect you against common sexually transmitted infections such as, chlamydia and gonorrhea, and then trichomoniasis, right? But it doesn't protect you against sexually transmitted infections that are on the skin. For example, the scrotal skin, for example, such as warts and herpes. So you still can get a sexually transmitted infection that way. So the next bit of the equation would be monogamy.
Okay.
Or having a stable relationship and not having too many partners, and with barrier methods of contraception all the time.
All right. Now, if one is in a monogamous relationship, it does not mean that they are entirely protected from STDs, or sexually transmitted diseases.
Yes.
In fact, many of them come in with diseases because one of the spouse, goes astray and has another partner.
Yeah.
Now, are there anything that you would recommend couples to do to ensure that both their sexual health are in good state?
Yeah, I think what you're pointing towards is this interesting term called serial monogamy, where you have one boyfriend for 1 or 2 years, and another boyfriend another 2 years, another boyfriend. So you've had several partners in your lifetime before you want to have kids and things like that. So that's definitely where you get exposed to sexually transmitted infections. Most of them are silent. You can't really see it, and even herpes can be carried and not knowing about it. And HPV is another big one, which is the biggest cause of cervical cancer. That 80-90% of the American population have HPV on them, and that's transmitted sexually. So the best way to prevent it is avoiding too many relationships and barrier methods.
All right.
Yeah.
Now, Doctor, we've covered a lot of different topics through this entire series on women's health. Do you have any last advice for women out there regarding their sexual health?
Well, I think it all comes down to improving general health. In most cases, it's if you have a healthy diet, you're exercising regularly, and you're doing all your screening regularly, which is, your pap smears, your breast examinations, and your pelvic ultrasound scans and things like that, you should be okay.
All right.
All right. Well,
That's very